Now, the United Nations Security Council recently adopted a resolution condemning attacks on healthcare workers and facilities in conflict situations, demanding compliance with relevant international humanitarian law. Adopting Resolution 2286, which was co-sponsored by more than 80 member states, the 15-member council strongly condemned attacks and threats against the wounded and sick, medical personnel, humanitarian personnel, as well as hospitals and other medical facilities. It deplored the long-term consequences of such attacks for the civilian populations and healthcare systems of the countries concerned. UN Secretary General Ban Ki-moon told the council that intentional and direct attacks on hospitals are war crimes. Johan Liu is the international president of Doctors Without Borders, MSF.
Until October 3rd, I truly believe that the hospital was a safe place. I cannot say that anymore about any medical facilities on the front lines today. In Afghanistan, the Central African Republic, South Sudan, Sudan, Syria, Ukraine, and Yemen, hospitals are routinely bombed, raided, looted, or burned to the ground. Medical personnel are threatened. Patients are shot in their beds. Broad attacks on communities and precise attacks on the health facilities are described as mistakes, are denied outright, or are simply met with silence.
Liu also added that in the worst cases, the attacks amount to, quote, acts of terror. Now joining us live via Skype from New York City is Mike White, the Deputy Operational Manager for Medecins Sans Frontieres programs in Chad, Ethiopia, Sudan, South Sudan, and Liberia. Mr. White, welcome to Africa 54.
Yeah, it's a pleasure to be with you. Thank you.
Let me have your reaction on Ms. Liu's statement, especially when it comes to Africa, the region where you work. What is the security situation there?
Well, I mean, as you and your viewers, you know, I mean, Africa is obviously a very big place, and we don't have any one security set of protocols for any one place. Certainly in the conflict areas where we're working, certainly Sudan, South Sudan, it becomes a little bit more precarious. For us as a medical organization, I think the first thing that's most important to recognize is that security for us does not exist in a vacuum. I mean, security is something that that is important for us so that we can access patients. And as a medical organization, it's being able to access the people most in need, and people who have need of healthcare. And certainly, I thought Joanne, Dr. Liu, our international president, spoke to this remarkably. It's not just the attacks themselves; it's the collateral damage on the existing health structures and the health networks that are no longer able to function. 75 plus MSF supported hospitals have been attacked in the past year, making the work extremely difficult. But just to reiterate that in the places, certainly in Africa, where we're finding conflict to be a major driver, it's accessing our patients and accessing care, which are the key to our work.
So what are the security measures that are currently in place, and why do they seem to be failing?
I don't know if I would say that they're failing. I mean, let's be clear. I mean, I can speak specifically to MSF. Different NGOs are going to manage their security different. I mean, what we can say globally in the international NGO community is that over the last 2 decades, we've seen the more professionalization of security. So this is using maybe ex-military people or ex-security personnel to manage security protocols, and in some cases to manage security in the field. That's not the case generally for MSF. Again, to highlight the fact that we are not a security organization, we're a medical organization, and our core expertise are our doctors, our nurses, and our paramedical personnel working in the 70 plus countries that we're working around the world.
So you are not, yes.
Yeah.
as you mentioned, you are not a security organization.
Yeah.
So what is done then to keep staff safe? What kind of protocol is in place, staff as well as patients?
Yeah, I think that's a key question. I think it's also important to highlight that for an organization like MSF, we have obviously two different concerns, culminating with our staff. Important to highlight that MSF has 30,000 local staff working in our medical facilities around the world. The work that we do, whether in conflict or in more stable environments, whether we talk about Syria or South Sudan, or whether we talk about a stable HIV program, this work cannot be done without our national staff, and certainly in most cases they are obviously much greater risk. They do not have the opportunity like international staff do to evacuate a situation if it gets hairy, and to move to obviously more secure. Protocol and security in MSF is managed. We manage it hierarchically. So at the hospital level, we'll have a field coordinator, a project coordinator, who the one main component of their work, understanding that the primary focus is to manage the hospital, is security management. And then within security, and then that would go up to our country director at the capital level, and then up through the operational line to headquarters.
Dr. White, thank you so much for your time. We appreciate your insights. And that was Mike White, a Deputy Operational Manager with Medecins Sans Frontieres, MSF. And that's our health report for today. To stay in touch, find me on Twitter at Linord Moudou. Back to you, Vincent.
Well, Linord, thanks a lot. And be sure to watch Linord Moudou's health reports every Tuesday and Thursday right here on Africa 54.